By the end of this module, the student shall understand the concepts of monitoring and supervision, shall come to know about the principles and process of monitoring, get acquainted with the functions and types of supervision, get acquainted with the methods and steps of supervision. Supervision and monitoring. The word monitor is derived from the Latin word meaning to warn, and supervision stems from the word see. Supervision and monitoring are very important, integral and inseparable part of every program. Supervision has over the years provided program implementers with the opportunity to reflect on their practice and afforded them the necessary forum to reflect, evaluate, discuss and develop these innovative solutions. Adequate supervision has a positive impact on the day-to-day work with the client and the professionals. It has been observed by the experts at different levels that for effectiveness and sustainability of any program and resources used in implementing them, supervision and monitoring are important functions, but are frequently neglected. In many programs throughout the world, the monitoring units are weak and limited to ad hoc studies. In many organizations, monitoring have a negative image because these units may concentrate on problems, exposing weaknesses and failures. Instead, supervision and monitoring should be used in a positive manner to improve program's performance and increase its efficiency. Monitoring. Monitoring can be broadly defined as a frequent, largely routine-wise collection, analysis and reporting on information about the performance of the work in a program. Comparison of this with the program plans and connected decisions about the proposal for any corrective actions. Thus, monitoring aim at meeting information requirement for current program and project management. Monitoring primarily cover issues of finance and quality pertaining to inputs and outputs as well as actors and time used in implementation. It should usually also encompass some current assessment of direct results and may curiously address additional issues which may possibly be analyzed more thoroughly in some subsequent evaluation. Most monitoring is usually done by program or project responsible agencies. According to IndianSocialStudy.com, monitoring is the systematic collection and analysis of information as a program progress. It is aimed at improving the efficiency and effectiveness of a program. It is based on targets set and activities planned during the planning phase of work. Assess the progress on a day-to-day basis and thus helping to keep the work on track. Help to determine whether the resources available are sufficient and being well used. Provides a useful base for evaluation. Principle of monitoring. Monitoring must be simple. A complex or complicated monitoring system is self-defeating. The basic task of monitoring is to simplify the field level complexity. Monitoring must be timely. Timeliness is the essence in monitoring. Management require input from the monitoring system so that timely action may be taken. Also, timeliness is closely related to the credibility of monitoring itself. Monitoring must be relevant. It must be concerned itself only with the parameters which are relevant to program objectives. This also ensures that monitoring does not generate information that is not used or is not usable by management. Information provided through monitoring should be dependable. Monitoring will rely on monitoring findings only if the information is believed to be reasonably accurate. Monitoring efforts should be participatory. Efforts should be made to ensure participation by all individuals and institutions which have an interest in the project. Monitoring must be flexible. It is interactive in nature. It also gets reutilized with the passage of time. These two factors should not, however, lead to rigidity. Monitoring should be action oriented. Monitoring often leads to action. Consequently, it should follow pragmatic approaches, keeping the requirement of clients uppermost in view. Generating information for which there is no intended use should be avoided. Monitoring must be cost effective. Monitoring efforts cost money and time. It is therefore essential to make it cost effective, while principle of simplicity, timeliness, relevance and accuracy will lead to cost effectiveness. Computerization can also help to make monitoring more cost effective by reducing staff hours in data processing. Monitoring efforts should be top management oriented. Monitoring units should keep in mind the requirement of top management while designing the operating a monitoring system. Yet, at the same time, monitoring must take into account the fact that those who provide information to the system also must benefit, or the quality of the information provided will decline. Monitoring units represent specialized undertakings. Monitoring is not merely concerned with the collection and analysis of data, but with diagnosis problems and suggesting alternative practices. Monitoring and its main stakeholders. All of the groups that have a role and an interest in the objectives and implementation of development activities are the stakeholders in the monitoring process. The key stakeholders are the target group, direct beneficiaries, those who are responsible for ensuring that the results are produced as planned, those who are accountable for the resources that they provide to the programs and projects, and several associate parties could also be added to the list. There are two important consequences of the phenomena of multiple stakeholders. First, monitors must accept the fact that their efforts are but one input into complex mosaic from which decisions and actions eventuate. Second, there is an invariably strain that results from the conflict in the interest of these stakeholders. The multiplicity of stakeholders for monitoring generates strains for monitors in two main ways. First, monitors are often unsure whose perspective should be taken in designing a monitoring. Is the proper perspective that of the society as a whole, the government agency involved, the program staff, the clients, or any of the other stakeholders group? Second, the monitors must realize that sponsors of monitoring may turn on monitors when the result contradict the policies and programs they advocate. The responsibility of the monitor is not to take one of the many perspectives as legitimate one, but rather to be clear from which perspective a particular monitoring is being undertaken, while explicitly giving recognition to the existence of other perspectives. In reporting the results of a monitoring, a monitor should state, for example, that the monitoring was conducted from the viewpoint of the program administrators, while acknowledging that there also exists the alternative perspective of the society as a whole and of the client targets. Process of monitoring. Monitoring of development programs may be conducted at the organizational or national levels. Adequate implementation requires that there is a unit whose main purpose is to coordinate all the monitoring functions at its level. Top management receives information from the monitoring unit and from other formal and informal sources. Through management information system, right information is obtained in the right amount and the right time and is made available to the right person or right persons. The monitoring capacity of technical persons should continuously develop through monitoring framework outlines the objectives, inputs, outputs and outcomes of the intended project and the indicators that will be used to measure all these. It also outlines the assumption that the monitoring system will adopt. The monitoring framework is essential as it links the objectives with the process and enables the monitoring experts know what and how to measure. The work plan outlines how the resources that have been allocated for the monitoring functions will be used to achieve the goals of monitoring. It also outlines how personal time, material and money will be used to achieve the set monitoring functions. Through continuous communication and advocacy initiatives, a monitoring culture is promoted within the organization. For improving communication, advocacy and culture for monitoring, the existence of the organizational monitoring policy together with the continuous use of the monitoring system, outputs on the communication channel is required. Following functions are usually being carried out for monitoring: prepare indicator for each activity, collect data for measuring each indicator, analyze this data, present this analysis in a logical flow, use this information for effective improvement of activities or interventions. Monitoring indicators. Indicators are variables that help to measure changes in a given situation. They are tools for monitoring the effect of an activity. Indeed, indicators are the principal means by which a monitoring unit keeps track of program's capability, effectiveness and efficiency. Any monitoring system will therefore incorporate the use of appropriate indicators in these three aspects. Monitoring indicators of four types, namely input indicators, output indicators, outcome indicators and impact indicators. Input indicators describes what goes on in a project. For example, number of bricks bought on site and amount of money spent. Output indicators describe the project activity, for example, number of classroom built with the amount that is already spent on the bricks. Outcome indicators, it describes the product of the activity, for example, number of pupils attending the school. And finally, the impact indicators which measures changes in conditions of the community, for example, reduce illiteracy in the community. Unlike evaluation, monitoring refers to the continuous and routine data collection that take place during project implementation. Data collection is reported on a continuous basis to show whether the project activities are driving towards meeting the set objectives. Data collected is integrated into the program activities for routine gathering and analysis. Data collection also subject to verification to ensure its reliability and validity. Data collected is audited since all the project decisions are based on the data collected. The possible sources for data collection are work records, attendance records, input-output records, recorded observation, case studies, diaries, recording and analysis of important incidents, structured questionnaire, one-on-one interviews, focus groups, sample surveys, systematic review of relevant official statistics. The information that is gathered through the project implementation phase needs to be used to inform future activities, either to reinforce the implemented strategy or to change it. Additionally, results of monitoring outputs need to be shared out to relevant stakeholders for accountability purposes. Organizations must therefore ensure that there is an information dissemination plan either at the monitoring plan, work plan or both. Supervision. Supervision is an essential interpersonal interaction that has been general goal whereby one person, that is the supervisor, meets with another, that is the supervisee, in an effort to make the work of latter more effective. Supervision is an intervention conducted by a senior member of a profession. Supervision is a safe, confidential relationship whereby an opportunity is provided to reflect, question and seek guidance on a regular basis. It is seen as a supportive environment. However, supervision is not a straightforward process. Therefore, defining it into a tangible product is as difficult as rigorously assessing its effectiveness. In his book, Staff Supervision in Social Care, Tommy Madison in 2003 illustrates supervision to be a cooperative and facilitating process which aims to develop the worker's effectiveness, provide a suitable and appropriate forum for the workers to assure those whom he or she is accountable that he or she is acting responsibly, develop the worker as a professional person. Functions of supervision. According to Codison 1992 and Madison 2003, the three main functions that can also be called as role of supervision are educative, supportive and managerial. Types of supervision. Supervision is predominantly a one-to-one relationship between the supervisor and the supervisee. However, it is not always the case that this type of supervision is available. Different types of supervision are peer supervision, group supervision and team supervision. Peer supervision refers to the process where a new worker seeks supervision from another worker. Peer supervision can result if workers are unable to get good supervision as their immediate line senior has neither the time nor the availability to supervise them. Group supervision is a negotiated process whereby members come together in an agreed format to reflect on their work by sharing their skills, experiences and knowledge in order to improve both the individual and group capacities. Group supervision has several advantages. Unlike one-to-one supervision, the group provides a supportive atmosphere in which new staff or trainees can share anxieties and realize that others are facing similar issues. The group supervision can provide a range of different perspectives on cases or individuals. Team supervision, unlike group and peer, involves working with a group that has not come together just for the purpose of joint supervision, but have interrelated work life outside the group. Team supervision is closely aligned to professional supervision and involve an independent person offering professional supervision to a team. Methods of supervision. Direct supervision. Direct supervision shall require the supervisor to be physically present in the direct treatment area of the client related activity being performed by the supervisee. Direct supervision requires face-to-face communication, direction, observation and evaluation on a daily basis. Routine supervision requires direct contact at least daily at the site of work, with interim supervision occurring by other methods such as telephonic, electronic or written communication. General supervision requires face-to-face communication, direction, observation and evaluation by the supervisor of the supervisee's delivery of client services at least monthly at the site of client's related activity, with interim supervision occurring by other methods such as telephonic, electronic or written communication. Process of supervision. The process of supervision occurs within the relationship established between the supervisor and the supervisee. Supervision is different from brief interaction such as workshops and consultation. As supervision is ongoing, it allows for the relationship to grow and develop. In supervision, supervisor evaluates, monitors and serves as a gatekeeper. Supervisors have an ethical and legal responsibility to monitor the quality of care that has been delivered to the supervisee's client. In order to enhance the professional functioning of the supervisee and assure quality of care, the supervisor constantly provides feedback regarding supervisee's performance. This formulative evaluation forms the basis of the work done in supervision. 5 steps of supervision. For making the supervision relationship work well, it would take into account what supervisee needs in order to do their job well. It would also consider what responsibilities the supervisor has towards their supervisee, what the limits of those responsibilities are and what responsibilities supervisee have towards their supervisor. On the basis of this, the 5 steps of supervision are: provide employees with the tools they need to do their job. From computers and a fax machine to pencil, ring binders and patient education brochures, the tool can be anything tangible that is needed for the job. Provides employees with the training they need to do their jobs. The key thing to remember is that the learning process is often more difficult than we realize. While some people are quick studies, others needs a lot more time to absorb training. One common error is to take an approach of training that is too informal. Health supervisees set goals to improve their performance. What should supervisee priorities be and what level of performance should you expect from them? It is management's responsibility to provide each member of your staff with some direction on these issues. The best way to do this is by helping them set their own goals for improvement. Ask a staff member to change a goal if it does not seem appropriate. Similarly, direct a staff member to add an extra goal. Become a resource. Provide people with tool, training and goals is a good start, but What happens when they reach an impasse? You can encourage staff to look to you for help if you show that you are available, approachable and willing to listen with an open mind. However, you also must be careful to let supervisee retain responsibility for accomplishing their goals. You should be resource, but you must not take on staff's member responsibilities. Hold staff accountable. Make sure people have opportunities to account for the progress that they have made on their goals. How often you should ask staff to report on this? That depends on the nature of the goal. If an supervisor's goal is to get to work on time, tell him to report weekly. He would use a written form and each day he would write both the time that he was supposed to arrive and the time that he actually arrived. Then at the end of the week he would hand it to me. In an extreme case, ask him to report in writing every day. This becomes an excellent record of achievement when it comes time for salary review. And if you need to terminate an employee, you will have a good documentation to support your decision. While the 5 steps of supervision encompass the manager's responsibility to employees, the flip side of this is that employees have 5 corresponding responsibilities. Employees are expected to use the tools that are provided, make the most of the training, set goals and then pursue them, ask for help or guidance if they reach an impasse and account for their progress. These 5 steps of supervision provides a management system that helps you to nurture high flyers. This system also helps you to diagnose poor performers and challenge them to do better.